Hi there, and welcome to our channel. If you're here, chances are you or someone you care about is looking to understand more about an enlarged prostate, also known as benign prostatic hyperplasia, or BPH. This condition affects millions of men worldwide, especially as they age. But don't worry, today we're breaking it all down. We'll cover the signs, symptoms, and key information every man needs to know. So, let's dive in. First, let's talk about the prostate. It's a small walnut-shaped gland located just below the bladder and in front of the rectum. Its primary function is to produce seminal fluid, which nourishes and transports sperm. While it's small, it plays a big role in men's reproductive health. As men age, it's common for the prostate to grow larger. This growth is what we call benign prostatic hyperplasia, or BPH. It's important to note that BPH is not the same as prostate cancer. It's a non-cancerous condition, but it can still cause significant issues. The exact cause of an enlarged prostate isn't fully understood, but it's closely linked to aging and hormonal changes. As men age, levels of testosterone decrease, while levels of another hormone, dihydrotestosterone or DHT, increase. This imbalance is believed to stimulate prostate growth. Genetics and family history can also play a role. If your father or brother has had BPH, your chances of developing it are higher. Additionally, lifestyle factors like obesity and lack of exercise may contribute to the risk. Now let's talk about the symptoms of an enlarged prostate. These typically fall into two categories: urinary symptoms and complications due to bladder obstruction. Here are the most common ones: frequent urination, especially at night, known as nocturia. If you're getting up multiple times to use the bathroom, that could be a sign. Weak urine stream. You may notice that your urine flow isn't as strong or steady as it used to be. Difficulty starting urination. A feeling of hesitation or needing to push to get started. Incomplete bladder emptying, feeling like you still need to go even after you've just gone. Urgency to urinate. A sudden strong need to find a bathroom immediately, dribbling at the end of urination. A persistent drip after you think you've finished. These symptoms occur because the enlarged prostate presses against the urethra, the tube that carries urine out of the body, making it harder for the bladder to empty completely. While these symptoms might seem manageable at first, untreated BPH can lead to more serious problems. For example, chronic urinary retention, when you're unable to empty your bladder, can cause infections, bladder stones, or even kidney damage in severe cases. That's why it's essential to address symptoms early. Ignoring them won't make them go away, and seeking medical advice can prevent complications down the line. If you're experiencing symptoms, the first step is to consult a healthcare professional. They may perform tests such as a digital rectal exam, DRE, to feel the size of your prostate, urine tests to rule out infections or other issues, and a PSA test to measure prostate-specific antigen levels and rule out cancer. Treatment options vary depending on the severity of your symptoms. Mild cases might only require lifestyle changes, like reducing caffeine and alcohol intake or managing fluid consumption before bedtime. For more significant symptoms, medications like alpha blockers or 5-alpha reductase inhibitors can help relax the prostate or shrink it over time. In severe cases, minimally invasive procedures or surgery might be necessary. Here are some practical tips for managing symptoms. Stay active. Regular exercise can improve overall health and reduce symptoms. Maintain a healthy weight, as obesity is linked to an increased risk of BPH. Monitor your diet by reducing spicy foods, caffeine, and alcohol, which can irritate the bladder. Practice double voiding by trying to urinate, waiting a few moments, and then trying again to empty your bladder more completely. And there you have it. Understanding the signs and symptoms of an enlarged prostate is the first step to taking control of your health. Remember, BPH is common and treatable, so don't hesitate to reach out to a doctor if you're experiencing any of the symptoms we discussed today. If you found this video helpful, give it a thumbs up, and don't forget to subscribe for more health tips and advice. Have questions or experiences to share? Drop them in the comments below. We'd love to hear from you. Thanks for watching, and we'll see you next time. Outro music plays as the screen fades to the channel's logo and a subscribe button prompt.